Overnight, COVID-19 changed the nature of health systems around the world, hastening the arrival of the future of healthcare, what PwC calls the new health economy. For 5 years, PwC has been tracking changes in the ecosystem, but the pandemic is rewriting the rules so quickly that every health organization must repair, rethink, and reconfigure. To emerge stronger, you must respond to market shifts, embrace innovation, and transform how you work. The new health economy is the transformation of health systems into a modular ecosystem of delivery, innovation, and wellness that's closely tied to the consumer and driven by a series of accelerating forces. COVID-19 accelerators include the virtualization of health, analytics-driven modeling platforms, the healing of the supply chain, and reprioritizing the social determinants of health. These accelerators are leading us to a new plug-and-play health ecosystem that offers improved care delivery, innovative diagnostics and therapeutics, alternatives to financing and payment, new approaches to wellness, and the platforms and support that facilitate the best experience. COVID-19 has shown what's possible when the healthcare industry works together to address a crisis. Now is the time to embrace the future of healthcare. For a chance to reboot and recreate a new strategic identity for the future, read the report today.